October is the National Breast Cancer Awareness Month, and the theme for this year is No One Should Face Breast Cancer Alone. I'm Dr. Suman Singh, Senior Obstetrician and Gynecologist at Rainbow Hospital, Managatta Road, and I'm here to talk to you about the signs and symptoms and the screening guidelines for breast cancer. So what are the common signs and symptoms? Typically, women come with complaints of feeling a lump or a mass in the breast. Some of them have symptoms of pain, some of them may have a nipple discharge, and some of them just complain of vague lumpiness. How do we diagnose? It's typically called a triple assessment program for diagnosing breast cancer. Now, what it involves is a clinical assessment. So a clinical assessment of the lump and also factoring in the age of the patient. The second is the imaging modalities. So it's either by ultrasound or by X-ray mammogram or by MRI mammogram. The third is a pathological diagnosis by a FNAC procedure or a TrueCut biopsy. Now, it is important that everyone screens themselves so that they're able to diagnose themselves on time. And if one uses these modalities, we're able to diagnose more than 95% of cases of breast cancer. So what are the guidelines for screening? Every young girl above the age of 20 years should do her self-breast examination every month. Typically, we say after the period. And this is a lifelong screening that she should do by herself. After the age of 25, that means from 25 years to 39 years, we recommend clinical breast examination once in 1 to 3 years if somebody has an average risk. And above the age of 40 years, they have to have a clinical breast examination every year. What about the mammogram? So, women above 40 years are recommended to have a mammogram done every 2 years for somebody who has average risk, and somebody who's in the high risk should have a mammogram done from the age of 30. Younger women, that is from 25 years onwards, if they have the high risk of getting breast cancer, they can also do supplemental screening with an MRI so that they are able to diagnose themselves early if there is a lesion. So it's important that everyone understands the guidelines and follows these screening patterns so that we're able to diagnose cancers early. Remember, if the cancer is diagnosed early, there's a good survival rate. In fact, the 5-year survival rate is almost 80 to 90%. So here's urging everyone to go home today, start learning about the screening methods and do their screening protocols properly.